Welcome, welcome. I am Dr. Danielle O'Connor. I'm a naturopathic doctor here in Oakville, same area here as Dr. Christina. We're so happy to have Dr. Christina with us today, talking all about thyroid health. We know that there's a lot of different factors that impact our thyroid function. And, really our thyroid is responsible for so many different functions within our body, and obviously like hormone control and balance. So this is a very important topic that we're going to be discussing today. But first off, I am going to pass the mic over to Dr. Christina so she can introduce herself and tell you a little bit about her practice.
Great. Thank you, Dr. Danielle. I am so happy to be back. I really enjoy doing these talks with you, and thyroid health is very, very big in my practice. I do find that unfortunately more women than men do suffer from a lot of thyroid dysregulation. So I really do love this topic. I'm very passionate about it. It is part of my workup. I mean, hormonal health, you mentioned that, and thyroid health is part of that. So I'm happy to be here. I also practice in the Oakville area. We're like neighbors, Dr. Danielle and I. So yeah, I'm really excited to talk about this topic.
Awesome. Okay, so we'll get started. And like you said, I know you said, thyroid testing is definitely part of your workup, and we know that there's definitely a connection. It is a hormone, it releases hormones. And so it definitely needs to be looked into regularly. But if we can kind of go right back to the beginning, just some general information, but like, what is the thyroid gland? What is the thyroid gland? And really, what is its function within the hormone and endocrine system?
Yes, it can be quite complex. So I'll keep it like as simple as possible. So the thyroid gland, I'm sure a lot of people know where it's located. It's like this little bow tie structure that just kind of sits like in our throat. A lot of times, even when you go and get a physical done, or even as well with us, a lot of times we may palpate the thyroid just to see if it's a little bit bigger, if there's any nodules or something called the goiter. That usually can give us indication that something's wrong with the thyroid. So the thyroid is a gland that sits here, and the responsibility of the thyroid is to release hormones, specifically T3 and T4. And what it does is it helps with regulating metabolism. That's one of its bigger functions, and also thermoregulation. So basically keeping our body temperature balanced, not feeling too hot or too cold. So that's its main function. Now, it also does affect other organs like your heart. It will affect your GI tract. It will also affect your sex hormones as well. So it affects everything. The endocrine system, the thyroid gland is part of the endocrine system. So the endocrine system is more of a complex network of all the organs and the glands, thyroid gland being one of them. And the responsibility of all these organs and glands is to, yes, release hormones to help just like balance the body. Whether it comes to growth or development or reproduction, that's its main job. So other examples of glands or organs would be like the pancreas or the ovaries. In our brain, we have the pineal gland, the hypothalamus, the adrenal gland. The adrenal gland is a big one for stress. So basically, they all work synergistically together. What I have found in practice, and all of us naturopaths do see this, is that a lot of times when one of the glands or organs are off, it's almost like a ripple effect. It just affects everything else. So basically, when one is off, you kind of have to look at the whole picture and make sure, like, well, what else is off? Because again, they all kind of work together. It's a very complex network, the way our body is. And yeah, that's pretty much it in a nutshell.
Amazing, amazing. That's great. Yeah, that's a great overview just to really kind of get started so that there's an understanding that, the thyroid gland and its function in itself is not just, like one sole gland, right? Like how it really does interconnect with so many other areas of our health. So What are some of, like really the common disorders, the common things that people see when, thyroid function is off essentially? And like, what are the things that people will experience? So what are the symptoms that they may experience when the thyroid is off?
Yes. So there is basically, so you have a normal acting thyroid, and then there's two other extremes. So we call it hypothyroidism, which is the underactive thyroid, and then hyperthyroidism, which is an overactive thyroid. So typically, what we do see more of is an underactive thyroid. There is also a name for it. So there is also when, so yes, you have hypothyroidism. But then also there is the autoimmune condition. That's when your immune system attacks your thyroid, called Hashimoto's. So again, underactive thyroid. And then with the hyperthyroid one, usually it's called Graves' disease. So that's when the immune system also attacks the thyroid, but the overactive one is called Graves. So Graves, hyperthyroidism, and then hypothyroidism and Hashimoto's. Now, the ones that we do see more so in practice is the underactive one. So big signs and symptoms that I have a lot of my female patients come in for, and one of their major complaints is things like fatigue, which right away could be related to an underactive thyroid. So fatigue, weight gain is another big one. Feeling cold all the time. So a lot of times they have those three, like, yes, I'm gaining weight. Yes, I'm feeling tired, I'm feeling cold. And another big one is also hair loss. Other things can be dry skin. They may notice their heart rate is a little bit lower, so it does affect the heart. They may also notice they're more constipated because an underactive thyroid is everything is slowing down. Depression could be another sign and symptom. In an overactive thyroid, just think of it as your thyroid is working much quicker. So a lot of the signs and symptoms would be like everything's working faster than increased heart rate. A GI symptom could be diarrhea. If the heart rate is increasing, then there's anxiety, there's insomnia. Again, because everything's working fast, then they're also dealing with weight loss. So it's very, and then because, sorry, not weight loss, weight loss. Sorry, I'm like, am I talking underactive or overactive? Overactive is weight loss. So they're like eating and they're like losing weight. And why am I losing weight? I'm hungry all the time. So it's more like an anxiety like picture. They may also experience mood swings. They may also experience fatigue because their body is so on. So that's the overactive. Underactive, everything just kind of slows down. So those are the two that we tend to see a lot of in practice.
Yeah, absolutely. And I think that's great that there's also how you mentioned, hypo, but then there's also like the autoimmune piece on that, right? And so I think that kind of leads into like how would people know in terms of testing if they first of all have a thyroid dysfunction of some sort, and then is it autoimmune, is it not? Yeah, if maybe you can go over just some of the tests that should be done, and maybe even some of the tests that you do in conjunction with thyroid tests, because like you said, it's about the full endocrine system, right? So it's not just the one test. So.
Yes. Yeah, great question. So typically, there are some main ones for thyroid. Depending on the lab that you work with, they may actually have a thyroid panel, which is typically what I like to use. So the main ones is TSH, or thyroid stimulating hormone, free T3, free T4. And then, so that's the basic one. But then there is the antibodies. So the antibodies are specifically to rule in or rule out whether we're dealing with any of the autoimmune thyroid conditions. So that would be the TPO antibody and the TG antibody. So if those antibodies are elevated, then we know, okay, we are dealing with an autoimmune thyroid condition. And then the other one I like to test for, it's called RT3, or reverse T3. That one's a good one because usually when we're dealing with an underactive thyroid, it's usually low T3. And so if the T3 is low, well, maybe the body's making more of this reverse T3. So you always want to include that, because if our T3 is high, then you're like, okay, well, we want to shunt things back to where it should be. So that's a big piece I find that maybe a lot of doctors don't test. So you want to do that. And then during a physical exam, if you feel that there was something going on, like a nodule, which I kind of mentioned, then you may want to, unfortunately, as naturopaths, we can't send out for an ultrasound, but you may want to refer out and say, okay, you know what? we also need to do a thyroid ultrasound. We want to see what's going on there because I felt something, it feels off. We want to make sure we can rule out things like thyroid cancer, which can be a contributing factor as well. So that's the main part just for the thyroid. But then it's like, well, what's causing the thyroid to be off? If my patient comes in and says, you know what, I've been stressed lately, the kids, work, that kind of thing. So right away, I'm thinking, okay, you know what? We also need to look at the adrenal gland. So the adrenal gland releases cortisol. So a lot of times they need AM and PM cortisol as well. DHEA, which is another big one. But then if they're also complaining about their periods being off, right? Or their hormones seem like not right, then I'm like, okay, well, let's see what's happening with our hormones. So then I will also add in the progesterone or the estrogen or the testosterone. And then there's also DHT. But then, you know, the other thing they could be complaining about, like part of like the weight gain is like, well, maybe their pancreas is off. Maybe we also need to look at insulin. So that's also one of the workups that I do because low T3 could also be related to insulin resistance, right? So it's like, okay, well, if insulin is an issue and that's what's causing or driving that low T3, well, let's look at insulin. So I will also throw in the fasting insulin. I will also throw in the HbA1c. And then the other things that I may look at as well, because usually inflammation is a big contributing factor. So I might throw in also the inflammatory markers like ESR, CRP, or HSCRP. So it's a big working diagnosis because it's not just you have an underactive thyroid here, take this natural supplement. I mean, it is, and that will help, but we want to get to the root cause. So what is driving that thyroid to be overactive or underactive? If stress is a big component, you can't just deal with the thyroid and forget about the stress because yeah, you're giving medication, but what, you want them to be on medication forever? When I say medication, I'm talking about the desiccated thyroid, which is the natural form of thyroid. You can't give that to them forever. I mean, you could, but if the stress is there, you're not really solving the problem. And as naturopathic doctors, we're all about, okay, we can give you this, let's manage your thyroid, but let's look at the full picture. If it's things going on with the hormones, meaning like your sex hormones, well, we need to address that. If it's the adrenals, we need to address that. And they all work synergistically together. So when one organ is off, it's going to affect everything else. So we want to make sure that all the organs, all the glands are working well, and everything is back to where it should be.
Absolutely. And I think that that's great as naturopaths. You know, we really do have the ability to test all of, you know, all of these areas. So really looking at the whole person, because like you said, it's not usually just one thing that's off our body as a whole, right? And so it does affect other areas. So absolutely, that's great. And I think that really gives a good idea to all the tests that you went through, just an understanding, because often we do see people come in with a TSH and that's it. And that's your thyroid is fine, check it off the list. But if you're really not doing a fulsome testing, you're not getting all of the information that you need, just like what you said with all of the tests that really need to be run, right? So yeah, very, very important information there. In terms of thyroid function, really, what are things that can contribute to abnormal function, right? Like what is leading to those thyroid numbers being off?
Yeah, a great question. So a lot of times it can be things like, we have to look at the basics too. So as naturopathic doctors, we're always looking at vitamins and minerals, deficiencies, that sort of stuff. So it's like, okay, well, one, let's look at the diet. What are important vitamins, minerals, or cofactors that help the thyroid to function? So things like selenium and zinc, they're both really important for T4 to be converted to T3. Well, what if that's low and that's driving the T3 low? So I would want to say, okay, let's look at selenium, let's look at zinc, right? Another big one is iodine, right? A lot of times we don't get enough iodine even from the diet. So things like iodinized salt, like sea salt, for instance, that can really help up it. The other thing is tyrosine, right? So tyrosine is an amino acid that's found in more protein foods. So things like meat and nuts and eggs, dairy, beans. If you're not getting enough protein in your diet, you're not getting that tyrosine. And tyrosine is required for your body to make T4. So diet is huge, and nutritional deficiency. So that's one. Another big thing is stress, which I've already mentioned. So major stress. Sometimes I have patients come in, they're like, oh, I had a huge stress happen. I just went through, a divorce. I moved, broken relationship, lost someone. So major stress is going to impact the adrenal. So therefore it's going to impact the thyroid. So stress is another big one. Another huge one, which I find a lot of times we don't think about it, but I have seen this quite a bit, is like a major illness or a major like infection. I find this is big for driving the autoimmune components. So of course, if you're dealing with an illness or if you're dealing with infection, that's your immune response. And if you had a major illness and it took you a while to get over it, well, imagine your immune system trying to like get your body back to normal. It's going to throw off your immune system. And then that's when the immune system starts attacking the thyroid. And then boom, we have the autoimmune Hashimoto's or the Graves. And I've seen that a few times with my patients. When I ask them the right questions, they're like, well, when did this start? What was happening in your life at that moment in time? Well, yeah, they had a major illness. Like I had bronchitis or I had pneumonia for so long, or even COVID. I had COVID for like 3 weeks. And it's like, ooh, that's an impact onto your immune system. Another big thing is hormonal changes. Women, especially pregnancy or after giving birth. So many women, I've seen this, I'm sure you have as well too, Dr. Danielle, that a lot of women, especially after, like that is a huge hormonal change in our body. Like what women go through when it comes to pregnancy and after delivering and then the hormonal changes that happen, it's stress onto the body. So I find a lot of women, after I gave birth to my son or daughter, I was diagnosed with an underactive thyroid. So hormones, pregnancy, menopause as well. I do seem to find it more so with pregnancy, but menopause too. Boom. So anytime there's that quick shift in hormones, it can affect not all women, but some women get impacted quite. And it also depends, I guess, their delivery as well, right? Because maybe there's stress tied into that. So there's that can be a huge impact as well. Another thing that we kind of don't even think about, it's just things we have in the house. Plastic also interferes with iodine uptake. So if you have a lot of like plastic water bottles or plastic, like even Tupperware, and if you're like, putting hot food in there, that's gonna impact your iodine uptake, which is going to impact your thyroid. So that's another big one that I actually never thought of, but I was like, oh wow, look at that, plastic. Medication. Things like metformin or SSRI actually will impact your thyroid gland as well. So there's a lot of inflammation. I mentioned that briefly as well. I do find if someone has a fatty liver or there's like either inflammation or inflammatory markers are elevated, well, that's also going to like drive down that T3. So there's so many things to look at when it comes to what the thyroid does and what other things can really impact it.
Absolutely. And I mean, you went through so many factors and I think that's fantastic. And the other part is that, realizing that as we go through life, our body's constantly changing. So like you said, whether it's like pregnancy or, a sickness, like our bodies are constantly changing. So just because you didn't have a thyroid condition when you were in your 20s, it can change, right? In your 30s, it can change again, right? So like we should definitely always be checking the levels. It should be done at least yearly, right? In terms of getting those levels checked, even if you don't have symptoms, it's always good to have that test done. So
100%.
those factors, absolutely bang on. I totally agree with all of those, and really having a good discussion with your naturopath and saying like these are things that have been changing throughout life. Could this be a factor? So definitely. But now it comes down to really, so we've gone through what the thyroid is. We've talked about the different tests that really should be looked at for thyroid function, contributing factors to having abnormal thyroid function. But what are some of those natural therapies that, you often will suggest to your patients, or different therapies in lifestyle changes that could be made to really improve thyroid function?
No, that's a fantastic question. So again, I mentioned diet first and foremost. So we look at things and what they're eating. So if let's say their T3 is low, but T4 and TSH seems fine, I'm like, okay, clearly a conversion issue here, right? So then we talk about, okay, selenium. Well, how can we get that from the diet? Brazil nuts, actually, which I'm sure you're aware of too. Like one Brazil nut, I think it has like 50 micrograms of selenium. Typically, we like to dose at least 200 micrograms. It's like have 4 Brazil nuts a day. You're getting your selenium. Zinc I find is a little more difficult to get from the diet, like oysters and mussels and clams, which is not something that people eat on a day-to-day basis that has the highest amount of zinc. So usually I would say, okay, you know, pumpkin seeds, but again, I find it's not as high. So a lot of times I would definitely supplement with the zinc. So that's one. We talked about iodine, right? So if you're not getting enough iodine from your diet, that's another thing. Or we may give iodine. Typically, I usually like when I give my patients their supplements, it's not just one item. It's usually like a thyroid complex kind of supplement. So usually we'll have the things like selenium in there. We'll have the things like zinc in there. We'll have the iodine in there. We'll also have the tyrosine in there. I mentioned also the diet, right? So having something that has all that. A lot of times I also like to incorporate maybe rhodiola. Ashwagandha, yes, but I'm always careful with autoimmune because it's considered a nightshade and inflammation. So that one I'm always careful if we're dealing with autoimmune, I avoid. But ashwagandha is another big one that I find that really does help. That's the main ones. I'm just thinking just underactive thyroid. When we're dealing with an overactive thyroid, then it would mainly be the main herb is called bugleweed. And then usually, and again, it's like a combination formula that I like to use. It also has with it, like, because everything is like this with an overactive. So it could be like lemon balm or valerian or just to have that calming effect. That's mainly the overactive thyroid. But one thing I should mention, herbs and vitamins, minerals, yes. The other thing is desiccated thyroid. And as naturopathic doctors, that's something that we can prescribe. So desiccated thyroid, it is a natural form of thyroid. Usually the source is a pig source. And what it is, it's a combination of T3 and T4. Which is nice. Unfortunately, the levothyroxine, the medical doctors give is only T4. And then great, you're making all this T4, but if you're not converting it to T3, then it's not very impactful. So we have that privilege of giving these prescriptions to our patients, and it's a combination of T3, T4. And what's great, a lot of pharmacies actually can add the selenium and zinc in there as well. So a lot of times, just to make it easy, I'll say, okay, I'm going to prescribe the desiccated thyroid. We'll also throw in like maybe 100 micrograms of selenium and 10 milligrams of zinc. So just ensuring that conversion is happening as well. So yeah, that's everything pretty much when it comes to what supplements I would consider giving. Now, of course, stress and all these other things are a factor. We may do like an adrenal support. I may recommend even acupuncture to help de-stress. I also do IV therapy. So sometimes I may do a combination IV therapy for adrenal and thyroid support will also be beneficial. And of course, if it's a hormonal stuff, and we address that as well. But mainly for the thyroid are the things that I mentioned.
Amazing. Amazing. Yeah, this is great information. So there's definitely help out there. You know, we've got Dr. Christina here today in terms of, you know, talking all about thyroid and different things that we can do, and just, you know, really having that understanding of your thyroid function and, you know, more about like awareness and what to look for. So yeah, I think this has been amazing. Thank you so much for joining us today here at Health Buddha and giving us all of this great information. Definitely reach out if you want to get in contact with Dr. Christina. We can get that all set up. And yeah, thank you again so much. And we'd love to have you back, and we can talk more about thyroid health or hormones or something different, but always a pleasure. So
thank you so much, Dr. Danielle. Always a pleasure being here. I really enjoy doing these talks with you. So yeah, I definitely look forward to the next one for sure. So thanks again for having me.
Okay, take care. Bye-bye, everyone.
Bye.